workers have been pleading with the public to adhere to COVID-19 lockdown regulations. The aim has been to decrease the rate of coronavirus infections in the country. Healthcare workers bear the first-hand account of the challenges posed by the pandemic in intensive care units, in emergency rooms, in general hospital wards, and even amongst colleagues. Reports suggest that the new variant offers its own unique challenges in as far as the public and private healthcare resources are concerned. Doctors are once again pleading with the President, that's President Cyril Ramaphosa, to urgently intervene. To discuss this, we are now joined by the President of the South African Medical Association, that is Dr Angelique Coetzee. Dr Angelique, good morning and welcome to the agenda, rather good afternoon and welcome to the agenda. This has been an ongoing cry though, around the pressures that the medical staff have been facing throughout the 9 months. Do you feel at all that when the calls came from the medical staff initially during lockdown level 5 and then lockdown level 4 as well, that those calls were being listened to?
Good afternoon, and good afternoon to all the viewers, and thank you for asking Sama's opinion on this. It is a problem. I don't think any country are being geared for a second or a third wave. So it's not unique to South Africa. But what we do have in South Africa is our own unique challenges, and there's a lot. So for this time of the year, Sama said before the festive season started, we urged and warned that a lot of the public facilities, as well as the private hospitals, would be running on skeleton staff due to the nature of the festive seasons. It's something that happens every year. I don't think there was enough done, especially in the public sector and especially in the areas where there is a high concentration of COVID-19 cases, as well as it is known that some of those areas also have a high incidence of trauma-related incidences related to especially alcohol and drug abuse. It's not only alcohol, it's drug abuse as well. We tend to forget the drugs and only carry on the alcohol part. And those hospitals should have had extra people, doctors, nursing staff allocated to them. It's still a huge problem. We are sitting in the healthcare, fraternity, public sector with a lot of moratoriums on existing posts. It's not even new posts, it's existing posts where we are in dire need of medical officers with experience to help and assist during this time. So SAMA is extremely grateful to the Northern Cape, which we solved last week the problem of 33 MO posts to the Kimberley Hospital. So at least there are going to be 33 new, doctors appointed coming 2021 January in that hospital. But that's the tip of the iceberg. It's the same problem in the Western Cape, same problem Eastern Cape, KwaZulu-Natal, Gauteng. You name the province, it's there. So there's a huge problem regarding adequate staff, nurses as well as doctors. Top of it, we are now in a festive season. We are seeing the trauma-related incidences coming in. We are seeing the steep incline of COVID-19 patients with skeleton staff. It is not sustainable.
This morning, looking in the Sunday Times, one of the people that they spoke to describing the situation in hospitals as a war zone. Can you attest to that?
It will be a war zone. And let me explain to you how it is. So you as a medical officer or a doctor will be working in ICU. Now, I think all of you have seen these clothes that they wear in ICU, in the COVID ICU. So you are busy in the COVID ICU, you are struggling with the patients. There is most probably a problem with enough stock. So while you're struggling with this patient, you will get a call that there are patients waiting in casualty that urgently need your attention. It means you have to get out of those clothes. You have to run down to casualty. You have to evaluate the patients lying there, knowing that maybe you only have one bed open in ICU. You have to make a choice in casualty. Who are you going to admit? Because you do not have enough hands, you do not have enough oxygen, so you need to make that decision. And it's not an easy decision to make. Then afterwards, you have to run back to ICU. You have to get into those clothes again. And so the day carries on. It's a battle between working in these wards, that is ICU or COVID wards, with the right clothes, getting enough PPE, because you cannot wear that same clothes going down to casualty. Every time and each time you need to get in and out of clothes. Then you are sitting with nursing staff that's also skeleton. A lot of them is not being trained for this type of work. So you also take the responsibility of the nursing staff. And then let's say there's 30 patients today that you have to look after. 30 that maybe doesn't sound a lot, but let me tell you, a COVID patient in ICU takes a lot of intervention, and it's not acceptable. The doctors can't, and the nursing staff can't handle this anymore. So the moratorium on posts needs to be looked at. This is a provincial problem. It's not a National Department of Health. It's a Premier's problem. It's a MEC's problem. It's Treasury. It's everyone's problem in the end of the day. But now it becomes us as doctors' problem because of the lack of posts. And one or two doctors need to work their asses off. They cannot do it. It's unsustainable. Cannot do that.
So the past 9 months must have been quite grueling for medical staff, especially, and in one interview someone describing it saying that, you know, when it comes to hospitals, they are always at level 5 lockdown, because that's how difficult things are. How would you describe the exhaustion levels that the medical staff are going through?
They are extremely exhausted. So you need to understand this exhaustion is something where you wake up this morning, you don't want to get out of the bed because you know what's waiting for you, but you have to. That's the moral and ethical implication of the work that you choose. You need to help people. So you get up, you go there, and the moment when you step inside the facility, the problem starts. The same problems, the same struggling that you had yesterday just continues today. The patients want answers. The families want answers. And there's no one. It's only you and maybe 2 other doctors. And you have to bear this. So what do? You cut off. You start, it's like you carry on from one patient to another. It's like a robot, just carry on doing its work. You suppress your emotions. You cannot let your emotions run away with you. If you do that, you will break. You will have severe PTSD. Tonight you go back home. You cannot really speak with your family. You are tired. You're emotionally tired. And this is what we are sitting. There's no, and some have said this before, there's no 6-week debriefing with social workers or with clinical psychologists. That is so important to get debriefing to those doctors and nurses that work in these terrible, terrible conditions. We have to debrief them. We have to help them. It's not happening. There's a lot of good people in public sector and private sector hospitals. But you can only take so much and not anymore. And then the system will collapse. If we don't urgently do something, the system will collapse. I can still carry on seeing those patients if I've got enough oxygen ports, if I've got enough drips, if I got enough PPE that I can wear every time that I go back to casualty and come up again. If I've got the infrastructure to support me, I can still maybe carry on. But if I don't even have the infrastructure, and I've got the numbers out there, and I've got difficult patients, difficult family, people that doesn't understand that it is what it is. I only have 2 hands. and we are 2 or 3 on call, it becomes really, really traumatic for those doctors and nursing staff.
Okay, and let's just quickly introduce Kasim Lukhoata into this conversation as well. He's from the Democratic Nursing Organization of South Africa. Kasim, good afternoon and welcome to the agenda with me. Just first of all, can you just describe the situation about how some of your own members are describing what it's like working during this particular pandemic, especially now during the festive season?
Good afternoon to you and to your listeners and to our colleague there from Summer.
Sure, I don't know if you got the question there, Kasim. Just wanted to know from your members, DINOSA members, what are they describing the situation to be like at the hospitals and the various health facilities that they're working at, specifically during this festive season?
Yeah, it is unfortunate and disturbing that during the second wave of the COVID, that the situation has not improved. We've battled on the first wave. And I can say with no fear or favor that we are not ready for the second wave. And a lot has to be done. And our members are battling on a day-to-day basis to cope with the pressure because of this level 1, which is not assisting the situation. The relaxation of a lot of stringent measures have been relaxed. And this has put a strain on our colleagues there in the hospital. We are dealing now both with COVID, the second wave, and we are dealing now with the carnage on the roads. The accident rates are extremely high. And we are saying that the Common Council have to really reconsider. If it means going back to level 5, let it be, because we're not coping. And the other painful part is that the very same people who had
Okay, we're going to try and see if we can re-establish that line with Kasim Lukhoata there, who's joining us from DINOSA, also in conversation with Dr. Angelique Coetzee. Dr. Angelique, just from your end and listening into what Kasim had to say there, he says, looking at the current situation, it's quite clear that we are not ready for the second wave. I don't know from where you're sitting and from the information that you have available, what are some of those indicators that tell you that we are not ready for that second wave? Or for the peak of that second wave?
Oh, we're still on our way to the peak. I don't know how long that will take. But it's easy to know that we're not ready for it. And because, as I have said, to have skeleton staff working during the festive season, traditionally the festive season is an injury season. It's a season due to alcohol and drug abuse. So it is always been like that. There was no reason why it should have been different this year. But on top of it, we've got the COVID-19. We know that there's not enough oxygen ports in a lot of these public sector hospitals. We know that the PPE is still not where it should be. We know that the CEOs of hospitals are struggling. We know that there is a supply chain problem. It is a no-brainer. So instead of we should have had a lot of healthcare workers and doctors on call. There should have been extra posts open in these areas that are hotspots. And it's not really happening. You cannot put 1 or 2 doctors into a healthcare system and 3 or 4 nurses and think they're going to be to be able to make a difference. It's not. You need a lot.
Well,
it's 24 hours. So yeah. You have 24 hours and you need a trained staff. I'm not talking about the young people only getting into the interns or ComServe posts. I'm talking about experienced doctors. There's enough experienced doctors out there.
Okay.
The posts are frozen.
Okay, we have Kasim back on the line. Kasim, earlier on you spoke about if we have to go back to level 5, so be it. But we were told that during the hard lockdown, during level 5 as well as level 4, we are preparing our hospitals to be ready for COVID-19 related admissions. And there were the field hospitals that were built as well. So what went wrong there? Was there a miscalculation? Hi, Kasim. Oh, okay. The line with Kasim is not helping at all. Okay, so Dr. Angelique, let's throw that question to you. So over the year, since March, during that hard lockdown, we were told that we're preparing ourselves to get ready for COVID-19 related admissions at hospitals. We also had the field hospitals that were built. Was there miscalculation of what exactly is needed?
I'm not sure whether there's a miscalculation as the fact that people doesn't want to hear and see what is right in front of them. My personal opinion, it's not a SAMO opinion, my personal opinion is that a lot of the political appointments or the politicians in the provincial departments of health and the MECs and the premiers didn't really expect a second wave and didn't really expect the second wave to be as steep as this one. And so by not understanding your enemy, you cannot prepare the war ground sufficiently. So it was not. There's a lot of things, we can sit here and we can blame each other and we can say whatever we want to. But this now needs to end. The fact that people in positions that need to appoint doctors and nursing staff cannot understand that your facilities need to be always ready. They need to be challenged, and SAMA is really going to challenge them coming January. And we are going to open it up. If we can't get any joy, if they're not listening to what we are asking, because we're not asking for a lot, we're only asking to employ doctors, make sure that the facilities are working, because public works is also a culprit here. So it's a 3 departments. It's a provincial of health, it is your treasury, and it's public works. All of them need to come to the table. We need to sit. We need to say, how are we going just to fill the posts? Because we are going to see a third wave as well. It's not going to go away, guys. It's going to stay with us for quite some time. The vaccines will come, but the vaccines will not solve all our problems. And we still need to get this system workable. And we're not asking for level 5. We're only asking for level 2 with extreme strict restrictions.
Okay, what sort of restrictions?
On social gatherings.
What sort of restrictions?
Social gatherings. We want to make sure that the churches, that you rather have church outside of 4 walls than inside, that there should be a restricted amount of people, clamp down on social gatherings, clamp, at weddings, at funerals, then please adhere and make sure that the current restrictions are enforced. Also, the public is part of this problem. They do not listen, and I say thank you to those ones who are really trying your best. But then there's a majority of young people especially, that do not listen. And they need to be held accountable. So if it is that if they don't wear their mask going into shopping centers, meaning that they then need to do community service, to pay a fine if they don't wear their mask, that is something we need to look at. Because we are trying to cut down and trying to enforce regulations on the owners of especially the hospitality industry. But you have to understand, it's not only the owners of the hospitality industry that's the problem. It's the people coming to them that doesn't listen, that are insisting on bad behavior. We have to change that.
Okay, we have Kasim back on the line. Kasim, then from your end, going back to a level 5 lockdown, what sort of restrictions are you looking for there?
Among the issues raised by Dr. Coetzee, the issue of the opening up of the alcohol, it has really gone out of hand. People are not adhering to this thing, and health education should be enforced. People need to be reminded that we're not out of the woods from the first level. Now we're on the second wave. Things are just getting out of hand, and people are dying, and we don't need to bring every proof. You just see how many people are being buried on a day-to-day basis. So as Dr. Coetzee is saying, the communities out there do have a role to play, because no amount of vaccine, no amount of policing will help them with the situation. We need the involvement of the communities to assist us to fight this enemy.
What would you say then to
Dr. Coetzee also mentioned, the part that we are very strong on is the shortage of staff. For crying out loud, that monetarium in the Northern Cape must be uplifted, because after this COVID, we're going to have those elective cases that has been piling up. The accidents and the assault cases are increasing over the weekends, and worse because it's holidays. We need each and every hand on deck. So those nurses who have been given contracts, those contracts must be terminated, and they must be employed on full-time basis, because we need their services. We cannot cope.
Okay, so Kasim, you have now mentioned alcohol problems. Dr. Coetzee has also mentioned problems in relation to alcohol and how it is putting pressure on the health sector. From your end, as DENOSA, would you say that let's evoke that the trading of alcohol again and impose that ban? Hi, Kasim. Okay, sure. The line with Kasim is really not favoring us today. Let's try with Dr. Angelique. Dr. Angelique, from your end, do you think that imposing a ban on the sale of alcohol could help alleviate the pressures that the health sector is currently facing?
It's temporarily. It's like putting a plaster on a festering wound. Salma had said this since the beginning of the lockdown 5, that we've got a huge social problem regarding alcohol and drug-related abuse and misuse. We are a country of binge drinkers, especially over weekends and on festive seasons and holidays. We need to address the problem. By bringing stricter restrictions, it's only going to help the hospitals and the trauma-related incidents regarding this misuse and abuse. But it's not solving the problem. We haven't solved the problem. You only put a plaster on a severely festering, fraught wound. And if you don't clean that wound, you're going to sit with this problem for many years to come. Hasn't been tackled in the past. Now we are reaping the fruits of a very disturbed social behavior that we are seeing.
Let's just quickly then touch on this new variant that has been discovered here in South Africa. From your members' end, have there been any clear explanation around the behavior of the virus and what caution or extra caution they may have to take?
So this new lineage or variant, it's got 3 different, I call it little cloaks that it wear, of which the 501 variant 2 is the one that is currently causing about 80% of our infections. And this variant is highly infective. Unfortunately, this at clinical level, the scientists still need to go and do their scientific calculations and all of that. But what we have seen at coalface, grassroots levels, this variant tackles from 20 years upwards. It doesn't care anymore your age group, doesn't care whether you've got high blood or sugar uncontrolled. What we do know, regardless of the age group, if you are severely overweight, that is a huge problem. And you don't have to have any other diseases, only this COVID-19, this SARS, this 501, and to get into ICU. So, and the clinical picture of patients out there is not similar to the one in the of the first wave. So anything from a severe tiredness to the cough and the temperature can be this 501 variant too. And that makes it extremely difficult. Unfortunately, a lot of testing has been done by the predominantly 20-plussers. We haven't started testing young people under the age of 20 yet, as in the first wave, we knew that they would not be severely ill. But I think going forward, it should be imperative that we now start to test young children as well to see the impact of this, although we know that they are really not that sick. I haven't in my surgery admitted any young child at this stage that I'm aware of for COVID-19, but adults 32 years and upwards, yes, we have admitted them in the second wave. And so it's extremely difficult. And on top of it, people are starting to panic, and they do not understand when to do this COVID-19 test, the swab, and just putting more pressure on us. So you can come in into the surgery with a sore throat, actually symptoms very similar to flu, and we test you, and you can be positive for COVID-19. But the test cannot distinguish between a live virus and a dead particles. So it might be that you just have flu, but because you tested positive, it makes it even worse now, and everyone close to you, your contacts, also no one to test. So maybe we're testing people unnecessarily. We do not know. There's a lot of things that we don't know, especially on this COVID second epidemic that we are currently seeing. And therefore, we ask people for very simple, easy things. Wear your mask. Wear your mask over your nose. Don't here. I don't know what you think you're doing if it's here. It should be over your nose. 1.5 meter is a broomstick length from each other. Be outside as much as possible, especially during the festive season with your loved ones. And wash your hands. That's it. It's not difficult. This 4 points the virus has not been able, doesn't matter whether it's 501.2, whether it's whatever, it still hasn't found a way through this 4 very easy steps. And that's what we want. But people are not listening. And again, for those of you that's listening, I really, really salute you. But those of you that are not listening, when you end up in casualty and there is not a bed available for you, do not ask where's the doctors. Do not ask why I might lose a loved one or myself, or I might not make it myself, because you didn't listen when we ask you to do the phone. And it's not only people, you can still listen and still end up in hospital. But if we can get people to listen, the majority to listen, I think we would be able to make huge strides against this virus and against this second pandemic.
Okay. Just quickly then, Dr. Angelique, in closing, I don't know if you have made any submission yet to the NCCC with relation to these strict measures that you want to be imposed. Would such a submission also include what you've just spoken now about this new variant and how some of the information is still not clear and some research is being done and therefore would warrant more stricter rules?
Yeah, SAMA would only ask to go to level 2. Again, what we have said, make sure that there is a restrictions on gatherings, because gatherings and shopping centers is our problems. Also, make sure that if your loved one is going to a hospital or to casualty because they're not feeling well, please do not take the whole family with. It is a COVID hotspot. Stay at home. Take your husband to the casualty, leave him there and pick him up if he can go home afterwards. Do not stay in those vicinities. Wear your mask. Do not go to a wedding not wearing your mask, sitting inside 4 walls, and then afterwards wondering why did you get it. Please, we plead with people to do this, because then lockdown 2 will be more than sufficient. We also need to ask the government to look at behavior, especially the young people, our severe alcohol and drug abuse. We need to address that. There's a problem, there's a huge problem. And by putting on a plaster while we've got a festering wound, it's not going to solve the problem. It's temporary. We have done that in the first lockdown, didn't address it afterwards. So we're going to address it again in the third lockdown, because there will definitely be a third lockdown, or not a third lockdown, a third surge sometime next year as well. So we also ask government, make sure that your public hospitals are on standard.
Okay, Dr. Angelique,
yes.
Unfortunately we're running out of time, but have you made any submission to the NCCC as yet?
SAMA is sitting on the Ministerial Advisory Committee, and we did raise this at that level.
Is it clear as yet whether or not there would be an announcement that we should expect anytime this week?
That I cannot say. That will be the prerogative of the Minister and Dr. Salim Karim. So we can just say that we, as doctors and from SAMA side, will identify a problem that we need to unfortunately curb again on a 1-level lockdown higher than we currently have. But we need to address the problems that is at the provincial hospitals and public sector, and don't forget that the private hospitals are not this squeaky clean. They also have their own challenges. Everyone needs to be addressed.
Thank you so
much.
And
I say thank you to all of my colleagues out there and the nurses who's working over this time. We salute you.
Okay, thank you so much there, Dr. Angelique. They're joining us from SAMA, the president of SAMA, in relation to some COVID-19 issues that would like the Ministerial Advisory Committee as well as the NCCC to impose to ensure that they alleviate the pressures on the healthcare sector.